The article is written by Dr. Gordon Gribble, who's a professor of chemistry in Dartmouth. He has been an advisor to us, the American Council on Science and Health, for many years. He has written an article about food chemophobia, the excessive fear about chemicals in food, in which he points out the lack of benefit that is to be derived from worrying about various trace levels of chemicals in food. I'm basically pointing out that these same chemicals are present, they're ubiquitous, they're everywhere. And these kind of chemicals are found in plastics and in flame retardants and everywhere, basically. Many activist groups have focused on these types of chemicals as being particularly toxic. Well, at high doses, of course, they are toxic, and the rodent experiments that give rise to the various carcinogenic designations and bans and restrictions are based upon rodent tests. There's no evidence that these chemicals, when ingested at normal, typical amounts in our diets, are harmful. We have publications that will describe the logic of this approach, similarly to what Dr. Gribble discusses in the article. We have something called a holiday dinner menu, which we published every year around Thanksgiving time, which basically goes through every course in a typical Thanksgiving menu, from soup to main course to dessert and coffee. And it points out all of the chemicals in the foods we eat that, when administered in high doses to rodents, cause various diseases. So if these were not natural chemicals, they would be called carcinogens and banned. In other words, if they were synthetic chemicals. But they're perfectly safe for us to eat.